I would push back and say there's some data that makes this interesting, at least to discuss. For example, the most common cause of death, we talk about, just mortality here is in many countries is cardiovascular disease, right? And so the potential benefit of alcohol use needs to be weighed against the risks of alcohol consumption and the potential benefits. And so, what are those potential benefits? There are multiple data sets showing that light to moderate alcohol consumption reduces some risk of cardiovascular events, but there's also some dissimilarity that, like, oh, it can reduce the risk of heart attacks, but it does increase the risk of other bad outcomes. At a median follow up of 6 years, not drinking compared with moderate drinking was associated with an increased risk of cardiovascular disease. Also, the French paradox you kind of talked about, alluded to that earlier. This idea that coronary heart disease mortality is lower in France than would be expected from the high national prevalence of smoking and saturated fat intake. And what I'm getting at is that there's at least some signal here that maybe warrants a more in-depth discussion than saying all alcohol is bad for everyone all the time in any amount.